Community action agencies across the country look different from each other on purpose. In the 1960s, leaders sought to combat poverty by engaging civic-minded people in new ways. Community action recognizes that one size does not fit all. Instead, those closest to local problems designed local programs, and a network of nonprofits was established across the country. Lorain County Community Action Agency has been a proud member of that network since 1966. In 1981, the Community Action Program transitioned to the Federal Community Services Block Grant. Only CAAs are eligible for funding under the CSBG grant, and there are now more than 1,000 agencies throughout the country who receive it. In Ohio, 47 agencies serve all 88 of our counties. The agencies differ substantially in size and programming because community action agencies continue to meet the unique needs of each community in purposeful ways. Identifying needs is now a formalized, data-driven process with mandates for state-approved work plans and budgets.
So the community needs assessment is actually a requirement of our funding, the Community Service Block Grant funding. And this year we also incorporated the needs assessment that is required for Head Start. And what we do in both cases for both of those grants, our grant plans are tied to the data that comes out of the assessment.
COVID-19 really showed us how many disadvantages low-income people have. With all that disruption, this year we turned to the Center for Community Solutions to help quantify and highlight the needs of today.
We use CSBG funding in the agency to fund programs that are really capacity driven. And what that means is when COVID hit, we had the staff on hand that knew our community so that they could respond. That's what CSBG does. It serves as a backbone for programming and services for low-income individuals so that this agency and the agencies that we partner with can respond to some needs that are ongoing, but other needs that are emerging. And in the case of the pandemic, needs that were crisis-driven.
So Head Start, although not funded by CSBG, also has mandates for assessing local needs. For us, the assessment is an essential first step to designing a program that deeply serves local children and families. What options should we offer? Where should we be located? What partnerships will enhance our services?
Lorain County is considered highly vulnerable to pandemics like COVID-19. We have a dense population, and our living and working conditions are rather crowded. We also have a number of older residents and a number of challenges surrounding housing, transportation, and our health system.
Assessing community needs involves both qualitative and quantitative data. Some of the data is from national sources, such as the U.S. Census. We also survey low-income individuals, both current and potential customers, and members of key sectors of the community, our churches and businesses, elected officials, school professionals, and other community organizations within our county. We worked with the Center for Community Solutions, in part because they had also worked with the Nord Family Foundation on racial disparities, the Office on Aging on our older residents, and the City of Oberlin's report on inequity.
The combination of these reports gives us all valuable current information so we can make plans and take action. Like everyone else, we have a new understanding of the complexities surrounding social determinants of health. Things like economic stability, education, access to health care, and the safety of neighborhoods.
The data and information gathered for Head Start is equally extensive, but focuses on the developmental progress of children, their health and nutrition, basic needs like food, housing, and safety. We also look at community resources for young children, potential hazards like lead paint or water quality, and family demographics.
The main thing we use the data for is to make sure that we're making changes to our programs and services on an ongoing basis, because we realize that what worked 5 years ago might not necessarily be the best approach today. Well, we do the community needs assessment every 3 years. And so what we may see is a change in which need is a bigger priority, but the top needs tend to remain the same over time. And when I say we do this every 3 years, I mean, we have been doing this now for more than 20 years. So we do have a sense on an ongoing basis. And then the community needs assessment allows us to do is to affirm what we're experiencing and what we believe we're seeing. And then it also allows us to do a little bit of a deep dive into the severity of different problems and needs.
Every year we use community needs assessment and the findings in our grant applications to ensure that we are advantageously located, that our services are accessible, and that we are strategically using our different program options to achieve high quality outcomes for children and families. And every one of our directly operated centers are 5-star under Ohio's Step Up to Quality program. Our deep commitment to meeting local needs is one of the reasons we consistently maintain that rating.
At LCCAA, we listen and serve with compassion and wisdom. We have a long-standing commitment to serve and empower Lorain County residents in need.